It happens like this. A person seems to see. They are not going blind. They do not complain about a sudden drop in vision. They can read, work, use a phone. But at the same time, there is a constant feeling that perfect clarity is still missing. Glasses seem to help, but not fully. The eyes get tired quickly. By evening, tension appears. Letters start to blur. Light from headlights or streetlights irritates more than before. And at some point, a question appears. If vision seems to be there, why is there no comfort? Very often, astigmatism is behind this. Many people know about astigmatism, but far from everyone understands it correctly. Often a person hears this diagnosis and perceives it as something unclear, secondary, or almost insignificant. Some even think that this is not a separate feature of vision, but simply slightly wrong glasses. In reality, astigmatism is a condition in which the optical system of the eye focuses light not into one clear point. To put it very simply, the eye sees the image not as evenly and precisely as it should. Because of this, the picture may be slightly blurred, distorted, or unstable at any distance, both far away and up close. To understand this without complex terms, you can imagine an ordinary camera. If its lens is set correctly, the image is clear. If not, the contours become less sharp. In the eye, the role of such an optical system is performed mainly by the cornea and the lens. Normally, they help light gather correctly on the retina. With astigmatism, this system does not work perfectly, and the person begins to see the world as if with a slight optical error. Sometimes this error is very mild, and sometimes it affects everyday life much more strongly than it seems at first glance. One of the reasons why astigmatism is often underestimated is its familiarity. If a person has had it for a long time, especially since childhood, they may simply not know that it is possible to see differently. For them, their picture of the world is normal. They do not compare because they have nothing to compare it to. It seems to them that everyone sees like this, that letters become less clear by evening, that the head hurts after reading, that the eyes get tired quickly from screens, that signs in the distance do not always look sharp, that at night the light from cars breaks into halos and streaks. A person gets used to constant visual strain and considers it normal, although in reality, the eyes are working all the time with an extra load. It is very important to understand that astigmatism is not necessarily a severe disease and not a reason to panic. But it is also not a small thing that can always be ignored. Everything depends on the degree, the person's age, whether there is accompanying myopia or hyperopia, and how much it affects the quality of vision and daily comfort. For one person, astigmatism almost does not interfere. For another, it becomes the cause of chronic visual fatigue, headaches, a sense of blur, and constant dissatisfaction with their vision, even if formally the person thinks that overall I see normalno. Very often, astigmatism is confused with myopia or hyperopia. This is an understandable mistake because all these conditions are related to vision and glasses. But there is a difference between them. With myopia, it is harder for a person to see far away. With hyperopia, close work or focusing in general may be more difficult, depending on age and degree. But astigmatism is not simply a matter of distance. It is a matter of the quality of focusing in general. That means a person may see unclearly both far and near, and sometimes complain not so much about poor vision, but that the image is somehow uneven, uncomfortable, unstable. Some patients describe this very accurately even without knowing the diagnosis. They say, "I kind of see but not perfectly," or "The picture is not exactly blurry, just strange," or "It is hard to explain, but my eyes are constantly straining." These are very characteristic complaints. Because with astigmatism, the problem does not always look like a coarse drop in vision. Sometimes it is precisely a constant feeling that the eyes have to finish the picture, compensate for inaccuracy, keep trying to see better than comes naturally. This constant effort is what creates fatigue. Astigmatism becomes especially noticeable in situations where fine visual work is needed. Reading small text, working at a computer, prolonged phone use, driving at dusk, studying, working with numbers, tables, drawings. All this may become more difficult. And the person often thinks that the problem is overwork, age, lack of sleep, or too much screen time. Of course, these factors also affect how the eyes feel, but if the underlying problem is astigmatism, no amount of rest by itself will remove the optical inaccuracy. It may temporarily reduce the feeling of fatigue, but it will not change how the eye focuses light. There is another common myth. Astigmatism is something rare and unusual. In reality, it is a very common feature of vision. Many people have it to some degree. It simply does not always require active correction. But when a person starts to notice discomfort, when vision is unstable, when ordinary spherical glasses do not give the needed clarity, when the head gets tired from visual strain, then astigmatism stops being just a word in a prescription and becomes a real cause of complaints. Why does it occur? Most often, astigmatism is related to the shape of the cornea. Ideally, it should refract light evenly. If its shape is slightly different, light rays focus not as they should, and the image becomes less clear. Sometimes, astigmatism is also related to the lens. In most cases, this is a congenital feature, meaning a person has lived with it for a long time, just not always knowing about it. But there are situations when astigmatism changes or becomes more noticeable over time. For example, after injuries, surgeries, or against the background of some corneal diseases. That is why here it is important not simply to know the word astigmatism, but to understand what kind you have and why it affects your vision in exactly this way. In children, astigmatism deserves special attention. A child can rarely explain exactly what they are seeing incorrectly. They will not say, "I have optical irregularity of focusing." They are more likely to start squinting, holding a book too close, tilting the head, quickly losing interest in activities, complaining of fatigue, avoiding long reading or drawing. Sometimes parents think the child is simply inattentive, lazy, or does not like to study. But the reason may be that visual strain is hard for them. If astigmatism is pronounced and is not corrected in time, it may affect the development of the visual system. That is exactly why preventive eye checkups for children are so important. In adults, the situation is different, but the logic is similar. A person adapts for a long time. They change the distance to the screen, look for brighter lighting, rub their eyes, squint, take pauses, buy drops for tiredness, change glasses, but ideal clarity still does not appear. Some begin to suspect serious diseases because they do not understand why vision does not become truly comfortable. And sometimes the reason lies in the fact that astigmatism either was not identified accurately or its correction was not chosen correctly enough. It should be said honestly, choosing correction for astigmatism is sometimes really harder than it seems. Not because it is something extremely complex, but because precision matters here. Not only the strength of the lens matters, but also its axis, meaning the direction of correction. That is why when a person says, "I wore glasses, but they were uncomfortable," it does not always mean that glasses do not suit them in principle. Sometimes it means that the correction requires more accurate fitting or an adaptation period. Especially if astigmatism was not corrected for a long time before. Another important misconception is connected with the phrase, "They told me I have astigmatism, but it does not need to be treated." A lot depends on context here. If astigmatism is small, causes no complaints and does not affect the quality of vision, a doctor really may not recommend constant correction. But if a person experiences visual discomfort, tolerates visual strain poorly, sees unclearly, has fatigue and headaches, then ignoring astigmatism just because it is not dangerous is not worth it. Not everything that is not life-threatening is harmless to quality of life. People often ask, can astigmatism go away on its own? If we are talking about the congenital feature of the eye's optics, it usually does not disappear by itself. Yes, the visual system can partly adapt, especially at a young age. Yes, a person may notice the problem less, but that does not mean that the feature itself is gone. So the hope that astigmatism will be outgrown or go away from exercises most often does not match reality. Exercises can be useful for workload habits, for reducing the feeling of fatigue, for a more reasonable approach to visual comfort, but they do not change the shape of the cornea in a way that removes astigmatism. It is worth speaking separately about contact lenses. For some people, they really become a good way to correct astigmatism. But here too, what matters is not self-selection, but precise fitting. There are special lenses for astigmatism, and they are different from ordinary ones. Not every lens will give the needed visual stability. Not every lens will sit equally well on the eye. That is why the approach, "I will buy something similar to the previous ones," may end in disappointment here. Sometimes a person thinks lenses simply do not suit them, while in reality the problem is that they were chosen without considering all the parameters. There are also those who are interested in laser vision correction, and here it is important to explain calmly. Astigmatism really can be corrected by modern methods, but the decision depends on the specific situation. The thickness and shape of the cornea matter, the stability of vision, the overall parameters of the eye, age, and the presence of accompanying conditions. Laser correction is not a universal answer for everyone, and not a cosmetic whim. It is a medical decision that is made only after a full examination. For some patients, this option is suitable. For others, it is not. And that is normal. The task of good diagnostics is not to sell a procedure, but to determine what is truly safe and reasonable for this particular person. It is also important to understand that astigmatism does not always exist on its own. It may be combined with myopia, hyperopia, age-related changes in vision. And then the complaints become mixed. A person may find it hard both to read and to look into the distance. They may complain both of blur and rapid fatigue. In such cases, it is especially important not to try to explain your condition with one phrase like, "I just have poor vision." Different optical features may be hidden behind that phrase, and they need to be corrected precisely, not approximately. Sometimes, astigmatism is first discovered when a person comes not because of blur, but because of headaches, fatigue, a feeling of sand in the eyes, or screen intolerance. This also happens because when the visual system constantly works under strain, the complaints do not always sound directly like "I see badly." A person may talk more about how they feel than about the image itself. That is why a good ophthalmologist always looks more broadly than simply at the numbers in the chart. They evaluate exactly how the patient sees, what bothers them, when discomfort appears, what changes during the day, how the eyes behave under strain. There is one more important point that is rarely discussed. Some people are embarrassed to complain about their vision because it seems to them that their problem is not serious enough. Well, I'm not blind. I kind of see. Probably everyone's eyes get tired like this. Because of this, they postpone an examination for years. But ophthalmology is needed not only when vision drops sharply. It is also needed when the picture does not let a person live comfortably. When working at a screen turns into muczenie. When by evening the eyes seem to run out. When reading requires too much effort. When vision formally exists, but the feeling of quality vision does not. This is also a reason to look into it. What does an examination usually include when astigmatism is suspected? Not only a chart test. The doctor evaluates visual acuity, performs refraction measurements, looks at the condition of the cornea, and sometimes performs keratotopography or other studies if the shape of the cornea needs to be understood in more detail. For the patient, this should not sound frightening. On the contrary, the point of diagnostics is not to guess, but to accurately see how the optics of the eye are arranged and which correction will give the best result. Because the difference between some glasses and well-fitted correction is often very noticeable. When is it especially important to come for an examination? When you feel that vision is never truly clear. When the eyes get tired quickly while reading, working at a computer, or using a phone. When heaviness appears in the area of the eyes or head after visual strain. When light in the dark part of the day has started to bother you more. When night driving has become less comfortable. When you have already changed glasses but perfect visual quality still is not there. When a child squints, tilts the head, holds objects too close, or gets tired quickly from activities. All this does not necessarily mean astigmatism specifically, but it definitely means that the eyes need to be checked. It is also very important that astigmatism is a story not only about clarity, but also about quality of life, about how easy it is for you to work, study, read, drive, orient yourself in space in the evening, watch films, notice small details, and not experience constant strain. Sometimes, after properly selected correction, a person says one simple phrase: "I did not know it was possible to see this calmly." And there is a lot of meaning in that phrase, because for years they lived in a mode of adaptation and did not notice how much unnecessary effort their eyes were spending. At the same time, there is no need to make the opposite mistake, to turn astigmatism into something dramatic. It is a common visual feature that modern ophthalmology knows how to work with. Here the main thing is not fear, but precision. Not anxiety, but understanding. Not trying to endure until the last moment, but the normal desire to understand why the eyes are uncomfortable and how to fix it. The calmer and more attentively a person treats their vision, the easier it is to find a solution that truly suits them. Sometimes the most important step is not to immediately choose glasses, lenses, or think about a procedure, but simply to have a good examination. To find out whether there is astigmatism, how pronounced it is, what exactly explains your complaints, and which correction option would be reasonable. Because vision is too important a part of everyday life to put up with constant blur just because you have long been used to it. If you feel that your eyes get tired quickly, that visual clarity is unstable, that glasses do not help fully, or that visual strain has become harder to tolerate, have an examination at the Ko'z Nuri Clinic. Calmly, attentively, and without unnecessary promises, so you can understand exactly whether your discomfort is related to astigmatism and which solution will truly help you see more clearly and comfortably every day.